Hi, I'm Maria Theoharous or Velosos on social media. This is So Organised Style Podcast.
In a rush, you get that window of 10-15 minutes. So our
Yes.
checklist was reviewed by a panel of health professions, and it really summarizes that key questions you need to be asking and having those conversations.
That's Radhika of Her Heart Australia. Ronda Hazell or Anarchy Coulter has been raising women's heart health awareness since she was diagnosed with a dilated ascending aorta. In this episode, Dr. Radhika of Her Heart Australia talks about the cardiologist listing they've been compiling and the women's health heart resources that anyone can access. Grab a cuppa and listen to Dr. Radhika now. Thank you for coming onto the podcast for So 50 on So Organised Style.
Thanks, Maria. Thank you for having me. Very excited to be here.
I'm so pleased that you've given me your time because we recently heard from Ronda Hazell. This is actually a good opportunity for us to hear more about her heart.
We are one of Australia's only not-for-profit organization dedicated to improving women's heart health. We also make sure to provide evidence-based education, supporting health professionals, and mainly our key pillars are around advocacy, creating awareness, prevention, education material, and other resources. So talking about Rhonda, one of our leading resources, Find a Female Cardiologist, which we are expanding at the moment to include more health professions within the phase. So I think we are very proud of the work we are doing, particularly around women's heart health.
When I was doing my research about her heart, it was very easy to find the drop-down menu to find the female cardiologist. So I think that's a really good resource for people in Australia to go to if they're looking for someone.
Yeah, absolutely. Because I think the way it was put into place was, women find it a bit challenging, especially in a country like Australia, where, the access is even more limited to rural and remote communities. So looking for a specialist who we get to talk and understand and directly connecting with them can be challenging. And that's how Find a Female Cardiologist evolved. It sounds like you've already had a look at. So as you scroll through, you can see that it really gives specific details about the cardiologist in individual suburbs. So it's very convenient for women to connect. We also know there's only 15% of cardiologists in Australia being women, and many regions simply do not have a female cardiologist available. So even for people to travel from rural to metro region, it's more accessible to figure out who's very closer. So we are also currently in the process of expanding it further. Please do follow us on social media to hear updates on the expansion.
Oh, that's really good. As more people are looking for a cardiologist, they find them and they go onto the Her Heart website and they can't see that person there. Can they contact Her Heart to get that person on the spreadsheet?
Oh, yeah, absolutely. So we are all about making sure that our organization is fully functioning on a consumer-centric approach, which predominantly is focused around working backwards, like really understanding what the community needs, and mainly our women, irrespective of the age and where they are located. We make sure we clearly understand what their needs are. If they are willing to add a female cardiologist into the portal, they can just simply reach out to us through our website. There's several ways to get to us, which you will find it through our website. Info at Her Heart is a great way to reach us. You can just simply let us know, hey, can you please add this person onto the portal, and we'll definitely make sure that's being further looked at.
Thank you so much. What is it about women's heart disease that we need to be aware of?
Can I take this opportunity to point out one of our other successful resource we have, which is called as a wallet card. So the wallet card has a male anatomy sort of a view, and then a female anatomy, and it literally points out and says what are the symptoms to look for. And until I saw Her Heart's wallet card, I never knew jaw pain was one of the symptoms for cardiovascular diseases, particularly in women. When it comes to women, I think even the way we are being triaged in ED, if it was a man to walk into an ED saying, hey, look, I have a bit of a sharp shoulder pain racing down my arm, I think the way this person would be triaged in the ED is going to be very different if the same symptoms were presented by a woman. We could be said, hey, maybe it was just one of those days, don't ignore the warning signs. Just go home, have a Panadol, get some rest. So I think even with any minor symptoms for women, because we are all built and wired very differently than men, I think it's very, very important to focus and listen to what our instincts say. Being more vocal, this is where we really stand out, trying to create those awareness in the community, not to ignore any symptoms, trying to really focus on putting women to put themselves first, especially when it comes to health. And even symptoms like fatigue cannot be just labeled because of stress. I think it's very important not to dismiss any symptoms. And as part of our key pillar towards advocacy, this is something we are very good at letting people know and making sure more members in the community are aware of.
As you said, women are socialized to give
Mm.
of themselves rather than to put themselves first. So that's a really good point to
Mm.
remember.
The silent sacrifices women is making, we
Mm.
don't want that even labeling as stress or tension to be accumulative and leading into a heart disease, which I must flag that it's number one killer in Australian women.
That's so sad to know, but it's good that we've got resources to help us
Absolutely.
navigate through that. In movies and TV, it's always the sore left side that
Mm.
is known. Women's symptoms are not the same, and that wallet is really clearly shows that there is that difference.
Women's heart attack symptoms are often very non-typical, and I think this is where I really use this word carefully, calling misdiagnosis happen. So some of the symptoms like nausea, back pain, jaw pain, or extreme fatigue are also causes of heart diseases, but it can also be leading to several other misdiagnoses, maybe just your monthly cycles, you've had a long day, you're handling multitask, etc. And this also takes us back to some important conversations like in emergency room, women can less likely to be taken seriously, which Dara has several times proven and shown that women often get sent home without appropriate test or care. I recently had an opportunity to talk at a clinical conference. The emphasis was mainly around improving or increasing women participation in clinical trials. If we're to, even yell out, hey, look, these are the 5 symptoms to look for women, we do not really have that evidence or mountain of data as how we have for men to
Mm.
say, hey, look, this has been happening in the last 30 years. So, we know this, the pattern is the same. Whereas clinical trials have unfortunately long excluded women or underrepresented women. So there's a severe gender gap in this place. And hence,
Yep.
we need to increase women participation in clinical trials as well in order to figure out or understand fully about women's heart health and the anatomy, right? The same point among First Nation, rural, and
Yes.
migrant women, it really adds on to another layer of issue, right? Because
Yes.
there's a several point of barriers, like you're culturally diverse, it could be a language barrier, the systematic change, the geographical representation, and these are all going to again lead into worsening those outcomes. So I think what we do here at Her Heart is really trying to bridge those gaps. So when we talk about in awareness, care, and access, we
Mm.
just don't focus on let's just look into women from 30 to 50 or 50 to 70. So we don't do that. We just make sure the evidence we are trying to build is really inclusive, irrespective of, the background and the region you're located. So that's what we are really advocating towards, to create more data. So in 10 years' time, we can reflect back and narrate a story a bit more efficiently.
With the evidence that you're collecting, it means that there will be a better understanding of the differences around women's heart health. It's the evidence, it's the knowledge, it's what we're collecting
Absolutely.
through
Yeah.
the research.
Absolutely.
Yeah.
Yeah. And I think that evidence is not just important for medical professions or other health professions in the
Yeah.
field. I think it's important for the community as well. So I feel all these 4 pillars are interconnected, right? You can't separate out awareness, prevention, and education. I feel it's all interconnected, and the heavy lifting has to be done parallelly.
The initiatives that Her Heart have put together the campaigns and the education. And I saw that there's a health check. I've seen that image quite a few times. Can you talk us through the education side that you're providing?
We do are careful in terms of getting a high standard of review before we put anything out. So we do have a fantastic team of clinicians, cardiologists who are generously been helping us out. And we also involve consumers because it's more like the word we use is a co-design approach. So it's almost understanding what a consumer needs and then working towards that. So in terms of this checklist you mentioned, it has an impressive download track record. It's been downloaded over 100,000 times, and
Wow.
that's globally. I think that clearly proves the need. So if a woman is being diagnosed with heart diseases, she'd already gone through enough challenges to, get into the system, get herself checked in. And once she's out of it, I think what becomes a lot more challenging is coming back to the track and really understanding what are the key questions to ask your GP or a cardiologist, right? Because we are all in a rush. You get that window of 10-15 minutes. So our
Yes.
checklist was reviewed by panel of health professions, and it really summarizes that key questions you need to be asking and having those conversations. It's literally like, have a copy on your phone, download it, just go into your appointment, and it's like a shopping do list where you can know what to ask and what needs to be answered. Adding to that, I think this is where we are very proud in saying, we do a lot of bold public campaigns that really destigmatize heart diseases women and bring in more public conversations. We do achieve this through several collaboration with researchers and other partners to push for the gender inclusive health data and then equity in the care. I think we're also very grateful that we do have that support network of women living with heart diseases and their families, because recovery is not just physical, it is emotional, right? So they have been very vocal in sharing their stories, letting us know what their experiences are. And I think those targeted response and hearing those stories from them really helps us to do this a little bit more towards that evidence based side, knowing this is the issue and this is where we are trying to address that gap and work towards with our community more closer.
I think our listeners would have seen
Hmm.
Rhonda's post on the Sober 50 account. So on the Sober 50 post that Rhonda put out, there was a lot of conversation about, when you're in front of the specialist, have someone there with you. And I think the having that checklist with you as well makes that visit with the specialist a lot more worthwhile when you walk away from there. So it's a lot to process, but then you actually have someone who can help you figure out, okay, what did the specialist actually say? What do I need to take away? Where can I go to? What can I do now?
Exactly. And I think, Maria, like I always like to relate to the checklist as if, you imagine you just had an interview. And the moment you finish the interview, you try to reflect on
Yeah.
yourself, right? Like if you're very desperate for that role, you're like, oh my God, did I miss that? I should have added that. I knew what they were asking. So I think you don't get that time back, right? You just get that one
Yes.
opportunity to go
Hmm.
back and provide your responses. So I believe that this checklist is that one opportunity where it really makes sure that you've used that rightly. Doesn't mean that, we can't schedule an appointment, but for the first appointment, I think it's very critical to know what to be asked. So some very basic things like, do you smoke or live in a high stressed environment? Like we don't even think about our daily lifestyle and some of the conversations being women, right? Because that really
Mm.
implies a lot of impact on our body, particularly around heart health. So yeah, I agree with you, Maria. This checklist has definitely been a big win, even with the responses and emails that we get from our community showing how much it has helped. And I think it's very emotional reading those responses from people with lived experience. But yeah, I think this is what we are here to do and help out.
It's good. It's really good to hear that it's not just one person telling you, what their
Absolutely.
experience is. You're getting a lot of different people giving you their experiences after using the resources and the learning from the campaigns that Her Heart is putting out.
Absolutely. Yeah.
So we've learned a lot about Her Heart. So what can listeners do to learn more about heart disease, to support people who have been diagnosed and all of those sorts of things? What are the key takeaway points that we as listeners should keep in mind to support others?
I would say learning the science would be the critical thing. So, learning the science, educate yourself on how women experience heart diseases differently. The second point I would raise is would be speaking up and sharing. So, whether it's on social media or in conversation, I think every woman voice matters. So, you're just a piece of post or a video or a podcast like this that you share and spread the message out, it could trigger another person. Oh my God, I did have some of these symptoms a while ago. Should I just go and get a heart health check done? Like these things does matter. And then encouraging others you care about. So the way I would like to think about this is, your immediate inner circle could be your aunt, your sister, your mom, your friend, to get a heart health check. It could save their life. I think that's critical as well. Here at Her Heart, we do a lot of educational and research and other initiatives. And I think it would be great to come on board as to support us, donate to us. We do have several membership programs where we offer high level resources back into the community. So every contribution that our community is able to make, it really fuels those changes towards getting the message out and thinking about sustainability and improving heart health in the long run, particularly for women.
Can I ask as well, herheart.org is an Australian organisation. Is it open to anyone to use the resources on Her Heart? So the listeners that I have are not just in Australia, but they're global. What's your view?
It's fantastic to know that you have a global audience. And I think the example I would like to quote here before I answer that is, we have this amazing Share Your Story portal where people share their lived experience story. And most of the stories we get are across the globe. And even with the 100,000 download I was talking about for the Her Heart checklist, it's not just in Australia, it's across the globe. So we are global. So we do have that global reach, including downloading resources, coming on board as member, being a supporter, donating, and some of our partnership is all global as well. So irrespective of where the audience or listeners are, we are more than happy to, bring that group of people, not just in Australia, but across the world in this journey with us. Yeah.
That's really lovely to hear. It's very encouraging too, isn't it?
Yeah, absolutely. Yeah.
Before we finish up, what's your takeaway points for our listeners and our viewers today?
As a takeaway message, I would say, or I would re-emphasize listening to your body, just thinking about emotionally and physically how to prioritize your health and what it's going to cost if you don't do that. And also trying to talk about shifting the narrative so you can give and still prioritize your own heart health. So when I say give, you can still keep the other socializing or the fun style of lifestyle that you're doing, but little things does matter. So checking out, our free resources or trying to look into the checklist and the survival stories and other guides would also be helpful. And finally, just talking about spreading the message out. If you follow Rhonda, you'll know she'll always creating, posts and contents over there. So I think just trying to spread the message out, reaching it to more people. Digital world is where we are at the moment. So I think social media plays a major role to just keep up the work going. Yeah, so I think those would be my key things.
Thank you again for your time, and hopefully lots of listeners will go over to herheart.org and get more information to help others.
Great. Thanks, Maria. And I really appreciate this opportunity to be able to, just be a minor part in spreading the amazing work that you're doing. I think it takes a lot of courage and thought into having a critical area like this to be focused on your podcast. I'm very grateful for the opportunity as well. Thank you so much.
Thank you too. It's really great to be able to support the community. This episode of Organised Style Podcast for Sober 50 was video and audio produced by me, Maria Theoharous, in my sewing room, with permission of Dr. Radhika and Ronda Hazell. Sound by Kaneef on YouTube. Many thanks for the ongoing support of the podcast Patreon contributors, as their membership every month enables me to create these video and audio podcasts for you for free. You can subscribe to Organised Style Podcast, spelled with an S, not a Z, on all good podcast apps and on YouTube now. Make sure you go back and listen to our free Sober 50 podcast archive on Soul Organised Style. Direct message Sandy and the editors at Sober 50 on Instagram to contribute to the ongoing posts and challenges that the team promotes to the community. I look forward to joining you in your sewing room next time. Stay safe, everyone.